And then the final class we'll jump to rank 22. Here is autoimmune. And what you can see here is a lot of different products. What's interesting about this, when you look at this one, that sticks out is, we included Humira and Enbrel in here. Some plans do cover it under both benefits. So, but since they're primarily covered under the pharmacy benefit for most plans, what you can see here is compared to other products, they've been trending significantly higher. And that again, I don't want to speculate. It could have something to do with the fact that because it's mostly covered under the pharmacy benefit, and there's other processes that are in place when the drugs are priced there. So you can see that. So then we have J0707 trending at around 40% over the 5 years with an 8% average trend year over year. Here's Remicade. You can see around a 39.4% overall price trend increase, but again, trending less than 10% year over year at 7.6%. We also have we get Stelara here around 43.5% total, or 8.26. So consistent price increases, but not trending as high on a year-over-year basis compared to some of the other products that we have seen. And then down here, you can see some of the max WAC costs for these drugs, and they range, I won't go through all of them, but anywhere from, let's say, $4,000 up to a maximum of $15,000 per treatment. Now, this graph is a little different. We have to orientate it slightly differently because of this number of products. This view, we pulled out the infliximab products because we thought it'd be in about a minute. I'll show you the infliximab view, just because now we're looking at price comparison of a branded and plus a biosimilar. But you can see the price increases, and of course, I mean, these big peaks here are Humira, and then the gray here is Enbrel, and those are the ones that are obviously, as we saw a few minutes ago, are trending at the greatest amount. And then we have the products below that trending at a much lower rate. So this is what it looks like for the infliximab products. So we have the Remicade product, J1745, that's been trending up. It was treatment cost in 2014 was around $13,000. Today, and again, these are the maximum potential prices. In 2018, it's around $15,000. Back in 2017, that's when Q5102, the first biosimilar code, was introduced. And what you can see here is that initially it was introduced at a price of treatment around $12,000, and then it quickly dropped to around $10,000. If we look at it a little closer here, this is a very similar view looking at the HCPCS level price. You can see how the blue line here is infliximab, how it's been slowly increasing. Here's Q5102. And then back in Q3 of 2017, that's when the Merck product came out. So we have two products in Q5102 for a short period, for a couple quarters there. And then in April 1st, 2018, that's when CMS made the decision to term the Q5102 and start separating out biosimilars specifically by the manufacturer, and that's where you have the Pfizer and the Merck product being split out. And you can see that the Merck product is priced from a HCPCS level perspective at a lower per unit cost compared to the Pfizer product.